Hi, it's Dr. Matt Harkness with Allied Physical Therapy, and I'm here with Dr. Rafael again. Good to see you.
Matt.
Well, I must confess, I'm going off the cuff a little bit. We're going to see what Dr. Rafael has to share with us, but we have been on the topic of wellness as a whole person. Mm-hmm. So, Dr. Rafael, tell us a little bit about what's on your mind in this topic.
One of the things I think for me, I know that's pretty much something that's very kind of misunderstood or not thought about a lot, or maybe there's a preconceived notion about is resistance training or strength. Okay, it's something that we don't take into consideration or even think about much, especially during the earlier stages of our life, our 20s, our 30s, or even our 40s. We don't really appreciate the amount of strength that one needs to resist the gravitational forces of gravity on our planet until we get hurt or as we age and we're not in the condition that we need. Studies show that between the ages of 40 and I believe 75, we lose between 30 and 35% muscle mass. Dr. Matt, that is huge. Wow. And the impact that can have on our ability to function within our environment, not just in our homes, but in our community as well.
So, sometimes even myself, I think of resistance training. I think of, going to the gym and pumping some weights or using some bands and try what is, give us a little bit more of a tone back, just kind of a realistic perspective on resistance training and some practical things that we should consider with that.
Yeah, resistance training gets a bad rap, I think, sometimes because we think of resistance training, we think of going to the gym and lifting all this weight and, really just sweating and just veins popping out and stuff like that. And that's not the case. Resistance training could be something simple as just getting up and down from a chair, several times. I love resistance bands when I work with my clients or patients. I love using resistance bands to kind of help with their overall strength, whether it's their core, their legs, and their back. And even just getting into certain positions to allow natural muscles to kick in to resist those forces of gravity can be really, really helpful. And that's also where sometimes people and experts like us can kind of come in and really help guide that person to really not just identify, which muscles are needed to strengthen, but what kind of muscles that you can safely, what type of positions you can safely get into in order to work those particular muscles.
Yeah, I had a patient recently. He said, I made a commitment to never use the elevator or the escalator. So he basically just always gets some strengthening in by climbing stairs and walking. And so I thought, hey, that's a good challenge. I think I should do that too.
Yeah.
Well, Dr. Rafael, that's really good. So, you guys, we were getting great feedback. I was in church, and people said, "Oh, I love your videos," and Rafael is getting great feedback. So, our most favorite thing is just being with you right now. We just love to just stay connected and be in this community here at Allied. And so, with that said, my challenge to you, maybe after you turn off this video, is to whatever your chair is you're sitting, just stand up nice and tall, engage the buttocks, tighten up the core, and then reach back and sit down and do 5 of those. And I think if you do 5 of those in between each program that you watch or first thing in the morning, that'll probably help, right?
Absolutely. I mean, anything that's going to push the limits of what you normally do is going to help that. And of course you get into the whole, oh, my legs get sore. That's a good thing. That's the brain communicating with your system, helping it to get stronger, so that way when you try to do that same activity again, it's not going to be as bad.
Well, thank you, Dr. Rafael. As we always say, we want to get you back to what you love, and it's our pleasure to be here with you. We can't wait to be with you next week.
Absolutely. Take care.